Hey guys, Jonathan here from Orchard Health Clinic. So today I'm going to be talking about shoulders, and we're going to be talking specifically about elevation of the shoulders. So that just means raising your arms up like this, which is very, very common in everyday life when we reach up for objects, when we play sport, when we catch things, when we hail down a bus, we are always doing this action. Now, a lot of people, they suffer from pain whilst they elevate the shoulder. Today we're going to look at strategies on how we can elevate the shoulder without producing the amount of pain that you're experiencing. So to first explain this, I need to demonstrate what the shoulder is and how it functions. So first, here we've got the bony example of the shoulder. So here's the humerus, which is just that arm bone that goes down here. And then we've also got the shoulder blade that sits on top of the rib cage, just like that, okay? So that shoulder essentially is a ball and socket joint, okay? So you've got a really, really small socket and a really, really big ball, okay? It's like a golf ball and a tee, a common analogy that gets thrown around. Now, in order to support that, the shoulder has a lot of mobility. We've got musculature. So we've got this rotator cuff musculature that helps to support our shoulder movements. So our big muscles do a lot of the work, our pecs, our lats, our delts, they all pull the shoulder out. This little rotator cuff muscle has to do all the work and support that. Now, over time, especially we see blokes in their 40s, they come in and they have a tremendous amount of shoulder pain. And usually what they've done is a rotator cuff tear. So that's a tear of that rotator cuff. And this is something that's happened over a long period of time. And they have difficulty in elevating their shoulder. So we've got Van here, our model. She'll come over here and she'll demonstrate what that painful shoulder elevation looks like. So as she raises her arm up this way, she'll get usually pain through this section right here, okay? And we call that the painful arc. When she's up here, she's okay, but when she's around here, very, very painful and sore. And this is usually okay, all right? In a most common scenario, but it can obviously vary. So what we want to try and do is encourage the rotator cuff to work accordingly. Now, there's a series of muscles here that stabilize the shoulder. When we're in this position here, it's usually one muscle that's not doing its job and the other muscles are not recruiting well enough. So we want to get this balanced recruitment of these muscles to help protect that ball and socket joint. So obviously treatment such as soft tissue therapy and manual therapy helps to mobilize and helps to get that socket moving, that ball moving in the socket accordingly. But we also need the person's brain to do some of the work in terms of operating that shoulder and getting it back into a more centered position. So this is what the YouTube clip's for. I'm going to guide you on how to actually do this. So we're going to come over here against a wall. I'm going to get Van over here against a wall. I'm going to go through it together. So what Van's going to do is she's going to just place her elbows up like this in this position. Yeah, okay. So now she's putting a little bit of weight in there. So obviously the further back she moves her feet, the more weight that she'll put on her shoulders and the more support her shoulders will have to give. Now the key things that you want to try and do here is you want to try and get those shoulders away from the ears. And you want to try and get this section, not arch, so you still want to do an arch for me. So you don't want that position there. You want more of this position here and you want to feel nice and centered. Now what I teach clients here is to try and get those shoulder blades. So we've got the shoulder blade right here and we want to try and engage that shoulder blade so it comes down into our back pockets and we get less activation of the traps. Now, as we do this, as we activate this area to keep this area neutral, we try and elevate those arms upwards and we try and keep that control position. What we don't want to do is, Van, if you just want to shrug up and do this, this is something that we commonly see in patients. That's something that we don't want to do. We want to keep nice and controlled through this motion and get them to raise up gently and keep control of that muscles and importantly, keep control of that rotator cuff on both sides. Now, obviously, if there's pain and there's discomfort in that position, then we stop at about a 1 out of 10 and we don't go any further, okay? We just want to try and practice nice controlled movement for the time being. Okay, so now that she's done that and she's competent at that and she feels comfortable, we go into more of a weight-bearing position. So then if you want to come over here and go onto all fours into what we call a quadruped position, yes please, and move onto your elbows for me if you can. Good. Okay. And then get the knees underneath the hips. Good. Now we're in a weight bearing position. Okay. So there's a lot of load going through the shoulders. Okay. If we come down more, there's going to be more load through the legs. If we come up more, there's going to be more load through the shoulders. So here we can practice that shoulder elevation in a controlled position. So here she's encouraged to use that rotator cuff. So can you just move those shoulder blades down just a little bit? That's good, that's good. And just here, can you press those shins down into the ground? Good. And then what I want you to do is keep that nice controlled spine angle. So if I got a stick right here in this position, okay, she has a nice neutral spine. And then as you come down, I want you to keep that nice neutral spine, and I want you to keep nice contact with the ground. Good. All right. And then I want you to slowly come back up. Good. So what we don't want to see here is then if you just let the spine go, let your core go, and the scapula coming off, and then the neck sinking in, and then we come up, we're going to get immediate pain in that shoulder because that shoulder is not in the right place. So this encourages that nice spinal angle and that nice smooth elevation of the shoulder in a nice controlled position. Okay, and there's many variants of that we can extrapolate from that and use to encourage shoulder stability. But at the end of the day, what we want to improve, if you stand up for me, Van, is that forward elevation in a controlled position. So after that, you've done those exercises, you can hold this stick, and I would prefer it if you go into this position, so you're in a nice externally rotated position, and then you kind of remember the cues that you had from the previous exercises, hold your arms outwards for me, and then start to elevate that shoulder and go into a position where you just get that slight little pinch and then you come down, okay? And you try and use those cues, so keep the shoulders away from the ears, try and keep the core nice and online, and raise the stick up in a nice controlled fashion, okay? So if you do this in conjunction with treatments and also get this guided by a professional, obviously, then you can have much more success in elevating your shoulder in a pain-free manner. So I hope this video helps. Thanks.